Welcome to FIMIA, the official podcast of the Parisian Institute of Modern Integrated Acupuncture. If you are an acupuncture practitioner or student, or you have an interest in acupuncture, make sure you go to fimia.com.au and sign up for free to receive notifications about all of our courses and resources. Are you aiming for more patients through your clinic doors? If so, then Kickstart Your Clinic, the acupuncturist's essential guide to setting up business, is designed just for you. Whether you are at the very start of your business journey or you're a seasoned traveler looking to add a few levels to your skill set, Kickstart Your Clinic provides you with powerful tools and invaluable advice on how to get your new clinic off the ground or to help boost the one you already have in operation. Simply go to fimia.com.au and click on courses to find out more about Kickstart Your Clinic. Proudly sponsored by AcuNeeds Australia for all of your acupuncture needs. Are you on Facebook? Why not join the discussion on the FIMIA Forum? FIMIA Forum is a free Facebook community where acupuncture practitioners, students, and enthusiasts alike can participate in an open platform to discuss the modern and integrated application of acupuncture. Search FIMIA Forum on Facebook and click join. Hi, this is Dr. Chris Ferris, registered acupuncturist. On this episode of FIMIAcast, I spoke with Jacinta Eales, who after graduating from her Bachelor of Health Science in acupuncture in 2015, went on to complete an advanced diploma in nutritional medicine. This allows her to prescribe nutritional supplements and provide naturopathic-style dietary advice, which she combines with her Chinese medicine knowledge. Her dream is to one day run a multimodality clinic with a strong focus on women's health. At present, as an acupuncture practitioner, she has a keen interest in women's hormonal disorders, skin conditions such as acne, and all things related to fertility. I caught up with Jacinta following her immersion in the seminar for Kiiko Matsumoto style of acupuncture. I found this to be an insightful conversation that explores the combined use of nutritional medicine along with the traditional acupuncture styles that stem from vastly different cultures. Here we are.
Exciting.
So, Jacinta Eales, welcome along.
Thank you, Dr. Chris.
Thank you so much for coming on FIMIAcast. It's good to see you.
Thank you. It's good to see you too.
How are you feeling?
A little bit nervous.
A little bit nervous?
Yeah.
The mics and the screens and the lights a little bit daunting?
There's a lot around.
That's okay. If you just close your eyes and pretend we're just talking, then you can drown out the sound of your own voice in your head and it will just be like we're having a real conversation.
Okay, I can try and do that.
How's clinic? What's been happening?
Clinic's been good. I've been practicing for 4 years now, which, time's flying.
Yeah.
Which is good. And I'm now in 2 different clinics on the north side of Brisbane, which is great. So I'm at Go to Health and Ginseng Acupuncture.
Yeah.
Yeah, which is awesome.
So that's, is that Rod Martin at Go to Health?
Yep, Rod Martin at Go to Health and John Taylor at Ginseng Acupuncture.
Yeah, cool.
Yeah.
So how did that come about? How did you end up going into 2 different clinics and what was the reason?
Ooh, okay, good question. So I was a little bit unhappy at one of my first clinics I worked in and I was kind of looking for something else, something a little bit bigger, a little bit closer to home as well. And I contacted my friend Adele and said, do you know any clinics that are looking for somewhere? And she said, yes, Go to Health is looking for an acupuncturist.
Yep.
So I contacted them and had an interview with Rod and I've been working there ever since.
Excellent.
Which is awesome.
Yeah, it's quite a big clinic, I've heard.
Yeah, very big. I think, I wouldn't know the exact number of practitioners, but maybe 30. There's physios, there's 2 GPs, nurses, dietitians, psychologists.
Wow.
Exercise physiologists, massage therapists. I don't know if I'm forgetting anyone, but there's lots of different people there.
And how do you find that being in a part of such a huge clinic? With the amount of people that, do you get a lot of referrals? Do you refer a lot to other people?
Yeah, well, I guess the idea with the whole business is the cross referrals. So, your patient client can come in and if you get a little bit stuck or you think they need something extra, is all the practitioners are working together and kind of cross referring. So most of the patients that come in are seeing more than one practitioner. As well, yeah.
Yeah, okay. And is that quite a contrast to working at Ginseng Acupuncture?
Yeah. I guess because at Ginseng Acupuncture, it's just myself and John, and also Laura Campbell as well. She's there. And we're not all there on the same days. So I'm there often by myself in the clinic,
Okay.
which is kind of nice. So it is that nice contrast. I get a few days where I'm just alone, treating clients, which is really nice. And then another few days where I'm in the big clinic talking to other practitioners and getting that, I guess, more social work aspect as well.
Yep.
So it's a nice balance.
Yeah. Yeah, I've certainly, in my own experience, when this used to be a clinic, I don't think I realized it until I moved out of here that it's quite isolated and a little bit not lonely. It's just nice to have that contrast of working with other people.
Yeah.
Yeah.
It is. It's really nice. So it's nice having the balance between the two. Yeah.
So after you finished your bachelor degree, you went on to study nutrition.
I did. I'm not sure why. Jumping straight into more study after already completing a 4-year bachelor degree, looking back, it was like maybe not the smartest move, but I was just so passionate about food and wanted to know how food could help people as well.
Yeah.
I thought I'll just do it. I'll jump in and study that as well, which was great. So it's just added that little bit extra, I guess, to my treatments, knowing a little bit more about, supplements, especially when clients are coming in and saying they're taking, XYZ big list of supplements. I can kind of look at them as well and help them work through them and work out what's best and give some advice around that as well, which is good.
Do you do a lot of treatments that are nutrition-based?
I wouldn't say completely on their own, but I definitely incorporate it into most kind of consultations as well. The acupuncture side of things, and then depending on what they're coming in for, we might delve into the kind of nutrition side as well. Yeah, so it's normally try to combine them together.
Yeah.
Yeah.
And do you find that has given you more insight and more ability to treat someone compared to what you learn as far as nutrition goes with TCM, traditional Chinese medicine?
Yeah, it definitely gives me, I guess, like a different viewpoint as well. Because at college, I know we do the one subject of Chinese dietary therapy, which is fascinating, but one subject nestled in with however many others that we did as well.
Yeah.
There's not a massive focus on using the food as medicine.
Yes.
So I guess doing the extra study, it did help me focus on using that a little bit more for each client as well. Yeah.
Okay. So the big question is, how did you find yourself becoming an acupuncturist?
Ooh, I get asked this question a lot in the clinic, actually. All my clients ask me. So before I was an acupuncturist, I was just working in an office. I was, I think, a personal assistant, administration person. And then I started studying musculoskeletal therapy. And I wasn't loving it. And I was also getting acupuncture at the student clinic at the same time to help me with a few different things as well, anxiety and things like that. And I was really surprised about how many areas of my life it could address and improved as well. And so the benefits I was getting was amazing. And I thought, you know what? I could do this. I could pop pins in people for a living. And I think I pulled out of my course and enrolled in the Bachelor of Acupuncture straight away.
So you were at Endeavour or ACNM?
I was at ACNM, doing the musculoskeletal therapy course. I think I was only 6 months into that course. And just wasn't loving it. It was a lot of hard work on my hands. My hands are a bit sore. So I switched.
Yeah, okay.
Yeah.
Yeah, it certainly does take its toll on your hands after a while. Do you do a lot of massage in your treatments now? I
do bits and pieces. I do like doing it. For some people, but it is hard work on my hands. So I try to limit how much I do in the clinic.
Yeah. So you have a big focus with fertility and hormones, hormonal health.
Yep.
Yeah. Is that specifically for women?
My main focus is women's health.
Yeah.
I guess I do treat a whole variety of things, but my big kind of passion and focus at the moment is women's health.
Yeah.
Yeah.
Yeah, okay. And is that anything specific that kind of spurred you down that path, or if I can ask?
Yeah, probably my own hormonal stuff, that I've dealt with since being a teenager. You get put on the pill at such a young age because, either you've got, period pains or they're irregular or your skin's bad and the doctors just go, here's the pill, and you take that for 15 years.
Yeah.
And then I started seeing a lot of clients come into the clinic that, similar situations, they're on the pill for a long time and they go off it and their periods are irregular and they're really suffering with pain and they're trying to re-regulate it again.
Yeah.
I'm just trying to provide them with the education around that to make those, informed decisions around their health.
And do you approach that from a strictly TCM perspective, or do you bring the nutrition into that as well when you're helping to regulate the cycle, for example?
I go mostly TCM based, but if other information comes up and do a bit of research around it, if I find nutritional information to support their cycles, dietary advice, lifestyle advice, I try and give them every bit of information I have to help them.
Yeah. And you're getting good results?
Yeah. It's actually pretty amazing how acupuncture and nutritional medicine can help regulate someone's cycle and help them fall pregnant or help them with their hormonal acne, all of those things. Quite amazing.
Yeah, absolutely.
Yeah.
That's good to hear. So with your treatment approach, you were saying before that we were talking a bit about dry needling and the kind of levels of intensity that acupuncture and acupuncture styles of treatment can be applied.
Yeah.
So anything with a needle, basically.
Yep.
How is your technique? Like you were saying that you're a bit more reserved or a bit more gentle with your technique?
Very gentle. I'm very, very gentle. I had one of my clients telling me that this morning, that I'm the most gentle needler they've ever had.
Okay.
Because I'm actually a little bit needle phobic. So I'm a bit scared of needles.
And you made it through the degree.
I know. I think I developed some of the trauma while studying and everyone practices on each other.
Of course, yes.
So I don't think acupuncture needs to be painful to be effective. And that's why I guess I've started going down the Japanese acupuncture route just a little bit, starting to learn a little bit more about that. So I definitely prefer the gentle acupuncture in comparison to that stronger stimulation.
Yeah.
Yeah.
So can you tell me a bit more about that? Is it more superficial needling? Is it gentler stimulation?
Gentler stimulation. So often when I'm popping all the pins in is I kind of go around popping the pins that I like, let them sit for a few minutes, and then if I need to pop them in a little bit deeper or move them into the muscle a little bit more to get a bit more of a response, it's just gentle and slow. I've changed the type of needles that I'm using, going more for the Japanese needles just for the fineness of them and the quality. So people are finding that they're less painful as well. Still probably similar retention time, still people are lying down for 20, 30, 40 minutes as well.
Sure.
But I'm definitely not looking for that strong, dirty type response from the needles. Okay. For most patients.
All right.
Yeah.
So is that something that you could compare to an even method in TCM as opposed to tonifying or sedating?
Yeah, I guess so. I honestly probably don't think that much about tonifying, sedating points as such, more the uses of the points as well. Yeah.
So you did your, what was the course you did recently?
Oh, I did the foundations of Kiiko Matsumoto style acupuncture in Sydney recently for 4 days, which was awesome, super awesome. And it really focused on kind of getting instant feedback from the body and helping you select the points that way. So they do lots of abdominal palpation and finding, I guess, tender spots, tight spots in very kind of specific locations throughout the abdomen. And then selecting points based on those tender, tight spots. And then once you select the right points and have them in the right direction, the idea is that you should be able to go back and repalpate those points straight away and find that they've released themselves as well. So you're getting that, more instant feedback from the body when the client's on the table.
Is this where I've seen they're taking the pulse and then applying acupuncture and then feeling the pulse as they're stimulating the needle to see if there's a change?
Yep, definitely. In the Kiiko style, we were learning about the stomach chi line, and so we hold the pulse and kind of, slide your hands down that stomach chi line on the lower leg, and you wait for the pulse to change. And then when the pulse change and feels nice and strong and even, they're the points that you choose to needle.
Okay, so the body is giving you feedback as to what it needs?
Yes, exactly.
I
Yeah,
see.
yeah. It just helps lets the body tell you what it needs.
Yeah.
Instead of us just assuming from what the patient is telling us as well.
Have you had a chance to apply that to in the clinic at the moment in
Yes.
your rooms? Yeah.
It's definitely very different going back into the clinic compared to when you're at a seminar and treating other acupuncturists that know what you're looking for.
Yes.
But my clients at the moment seem to be enjoying it. So I'm just kind of incorporating that into the beginnings of the sessions, is doing a bit of the abdominal palpation, a bit more of the pulsing as well. And then once I kind of get the desired result that way, then I kind of continue on with the usual TCM approach, probably with slightly less needles
Okay.
as well.
I guess it's difficult to determine, but I guess some practitioners have an average amount of needles they use in a session. Do you know what yours would be?
Oh, so it used to be about 20. I've probably gone down to under 15 for some patients now, depending on what they're coming in for. Might be about 10.
Wow.
Yeah.
Interesting.
Just keeps it a little bit gentler.
Yeah, so would you choose one side over the other instead of doing bilateral points, for example?
Yes, definitely. Definitely started doing that. Starting with one side of the body first, and then if I'm getting, those specific reflex points to release, then I don't need to move on to the other side of the body as well.
Yeah, okay. So you'd only use, like, if you needed stomach 36 or 40, whatever it is, you'd only use it on the one side, and then assuming that then provides that relief for the entire body, and you don't need both on both sides.
Yeah.
Okay.
I guess, that's the idea behind it as well.
Yeah. So with your when you're in clinic, what's a typical day for you?
Well, I always make sure I arrive at the clinic at least half an hour before I start. I sit down, have a look at my day, set up my nice towels, I guess get my head in treating space.
Yeah.
And then it's just seeing each client as they come in. For the most part, I just run one room at a time. Occasionally I will do two, which will get quite busy.
Yeah.
And we just have, each client come in. I try to give each client, at least 40 minutes of time. I prefer an hour, just so they've got time to wind down and relax. And if we've got the hour time, then we do have that extra time to do front and back treatment as well, which most people like and find they get a bit more of a chance to really get into that deep relaxation mode as well.
Yeah, okay. Interesting. So you, as much as you can, if you have the opportunity, you do front and back?
Yeah, I definitely do try to. I mean, I guess it depends on what they're coming in for. Sometimes I feel like they might need a little bit longer one side, so we might just stick to the one side. But if I can, definitely the front and back, I do like doing that treatment.
Yeah, okay.
As well.
You find you get better results?
Oh, I don't know about better results. I think they can be about the same. Yeah, I think I mostly just go on what the patient is feeling at the time. So sometimes they do like a little bit of massage, or they might request a few minutes of cupping, and that's when I'm more likely to turn them over and address the back as well. Yeah.
Do you do any other more like, what's the word I'm thinking of? Like unusual treatments or obscure treatments aside from cupping or gua sha or anything like that? Do bleeding or anything interesting?
No, I don't think so. I think I might just be a little bit, regular in that way. I do a little bit of your regular bleeding, the old sore throat point or the mastitis point type of thing. But no, I don't think anything particularly obscure.
Okay.
Yeah.
All right. Just thought I'd ask.
No, that's always a good question.
You were saying before that in college, when we're learning, you were wishing that you had some more real world experience before you got out into the clinic world.
Yes, I mean we get quite a lot of practical experience in the uni clinic where we have to practice for, gosh, I think I worked it out. It was like 500 hours we do in the student clinic before we're in real world, but we don't get much business experience.
Yeah,
and so you get out into the real world, and you go, "Hey everyone, I'm a great acupuncturist. Come and see me," and you kind of sit there going, "Ooh, how do I get clients to come in?"
Yeah.
I guess that's where you kind of muddle along with your marketing, accounting. That was a big learning curve for me when I came out, trying to do my own books and get an ABN and register myself with all the relevant people. Yeah, it would have been nice to learn a little bit more of that, I guess, before you step out, because you're completely on your own once you leave college, unless you have a mentor or someone like that.
And did you?
No, not one specific person. I had a few of my lecturers that I felt that I was comfortable enough with to ask some questions as well. But for the most part, I was kind of, muddling along by myself. I was in a big clinic as well, but mostly left up to my own devices. And so I just did the best I could, and I've just been learning as I go along.
Well, you seem to have done pretty well. You're still here. You're still going. You're working out of 2 clinics now.
Yeah, definitely. It's nice full-time acupuncture now, which is great. I think when I first left college, I still worked part-time for a little while in an acupuncture clinic doing administration, but it was fantastic learning. So I did get to see a bit of the business side of things from that, which was great. Yeah,
at least your part-time job is related to your career path and what.
Yeah, and I would say I learned a lot from those practitioners that I worked with then. Yeah, they were great.
Yeah, I guess that's a difficult thing for people who are coming out of college and then going into this potentially entirely new career. If they have the good fortune to already have been working in their desired career path in the first place, like as you were working in a clinic or even just a job not even related to the clinic but in the clinic is still going to help, I suppose.
Yeah, it definitely gave me a bit of an insight into what it is to be an acupuncturist and have that as your career.
Yeah.
So that definitely helped a lot. And those practitioners I worked with, one of the things that I learned from them that I've really taken away from that is, even though they've been practicing for 20 years, they are like never complacent with their knowledge. They are learning, they're going above and beyond, more than your regular CPD that you're doing each year. They're just always learning and learning. Yeah.
Yeah, you seem to be doing that. I see you.
I've got that from them, yeah.
Yeah. I'm surprised now. I don't know if it's just because I had no money when I was a student, but now seeing, when I go to courses or host courses, now I'm seeing a lot of students there.
I know.
Like a lot. And I don't know if that's a new thing or if it's always been that way.
I don't know, because I was probably the same at uni, you're scraping by, your head down in your book. And honestly, the idea of learning anything extra would have just done my head in.
Yeah.
I was too busy trying to get through my uni subjects, let alone learning something else. But yeah, now, like even in the Sydney course recently, there was a few people there that were still studying.
Yeah.
I was like, wow, this is awesome for them to be able to do that.
Yeah, it's very impressive.
Yeah.
That they have that desire to want to know more before they're even out practicing.
I know.
It makes you think of the caliber of practitioner that they're building themselves up to be when they get out there and start treating.
Yeah. Yeah, no, it's great.
So did you, seeing these practitioners before you had actually graduated and getting an idea of the business, were you intimidated at all about what was, becoming, graduating and then going out into the real world and seeing how it was going to happen?
Yeah. I think I was probably a little bit cocky. I kind of thought, I've got this. Looks manageable. I can do this.
Yeah.
I guess I didn't see a lot of the behind the scenes, when they were starting, because they had been in practice for 20 years.
Yeah.
And had, I guess really strong word of mouth referral base, and, I guess the business side of administration, front desk stuff all seems relatively simple. But I guess it's more the behind the scenes stuff that you kind of struggle with a little bit. And I guess probably I say more of the marketing side of things. So I went out thinking, this is great. I'm going to be treating 50 clients a week in my first 12 months.
Yeah.
Not exactly the case, but it builds slowly each year, improves, and you see more clients and more people see you and then refer you slowly as well. So it all just builds quite slowly.
Yeah.
Yeah.
I think the excitement of being in that position of seeing other practitioners, you become somewhat ignorant of the potential that it's going to be a really difficult, at times, exciting, yet sometimes tough journey.
Yeah.
Getting from just starting out, even if you're working out of someone else's clinic, you still have to build your patient list.
Exactly.
Yeah.
Yeah. I guess that's probably been something that, I've been learning as I go along as well, is I can't just rely on each clinic that I'm in to promote me, but to do that myself as well.
Yeah.
Yeah.
Yeah. And you seem to be doing that very well with your vids on Instagram.
You know what? Every time I do one of those videos, I actually have to psych myself up a little bit to do them because I get so nervous filming myself when no one else is in the room.
It's a little weird, isn't it?
It is quite weird. It's very weird.
I know what you mean.
Okay, well, I'm glad I'm not the only one.
Yeah, it's a little strange, but you get. Have you gotten used to it?
I'm getting better. I think I'm getting better at it. And so I'm trying to do more where I get myself in front of the camera.
Yeah.
I've recently signed up for the push-up challenge for mental health.
Yes.
And I'm doing that with a few people, local businesses in the area. And so I'm practicing by even just filming myself doing push-ups and putting that up without feeling any embarrassment like I would have previously. So I'm making progress slowly.
Yeah. I was talking to Trent Dolman before, and he insisted that I call him while you're here and have you do the push-ups right now. But I think we can
Yes, please no.
say no to that. So something that I took from one of your videos, I've seen quite a few of them, but something you said that when you described to your patients the frequency of acupuncture treatments that they may require for a condition. And you use the analogy of if you go to the gym once, it's probably not going to do very much. You need an exercise regime, or at least to be going for a period of time for you to start seeing results. And I thought that was a very, very good analogy, something that I've actually started to use with when explaining it to patients, because it's so good. It makes such sense.
Yeah, definitely. I think a lot of people expect to only come a few times.
Yeah.
And so I do like to kind of set the tone, I guess, in the first session and give them an idea of what to expect as well. It's like anything. It's like eating healthy as well. You can't just eat one salad and...
Oh, really?
Yeah, I know. It's disappointing. And then have everything, be back to normal or healthy. It's a long-term plan. And acupuncture is very much the same.
Yeah.
Yeah.
Yeah, it certainly has and I'm not sure where it came from, and I think other practitioners also don't know where it came from, this concept that you only need one acupuncture treatment to fix all of your problems.
Oh, wouldn't that be nice?
That would be nice, but we'd be out of business.
That's true.
But yeah, it's like a lot of other modalities where you need a plan. You need continuous treatments for, whether it be 2 treatments or 5 or months of treatments, depending on what the person is going through.
Exactly, yeah.
Yeah. And do you find that is something easy to convey to your patients? Do you have difficulty with that?
I guess, again, it depends on the person that's coming in. I mean, I get in the women with the hormonal conditions, or they're going through fertility treatment, and they're fine. They're like, yep, I understand that it's going to take a little bit of time to regulate my system, and they're honestly quite committed from the beginning. It's sometimes the people that come in with a sore neck or a sore shoulder, they go, oh, I need more than one, and then I have to do my best to explain how acupuncture works, and how many treatments, roughly to give it. So it's learning to articulate that to the different people as well that come through the door.
Yeah, sure.
Yeah.
And do you generally explain things from a TCM perspective, from a Western perspective? How do you do it? What's your script?
Oh, it changes. It changes every patient, because I'm still learning how best to explain that to people. So I have recently really gotten into watching and listening to Mel Hopper-Koppelman, if I'm saying her name correctly.
Yep.
And she, I think, is the director of the evidence-based acupuncture in the UK. And she has a few videos and some papers that's explaining acupuncture from that biochemical, Western medical side.
Yes.
I'm still getting my head around it. So I give it a shot with some of my patients, the Western medical side and how it works, with our neurotransmitters and even the basics of, creating micro traumas to promote healing.
Yes.
But I do like to stick to the TCM script to a point.
Yeah.
So if people ask, I try to give them, I guess, a little bit of both without too much. And if they want more information, then I'm always happy to provide that. But I don't want to overload them if they're just asking a kind of offhand question.
Yeah.
As well.
Yeah, that's something I'm certainly guilty of. People say, "How does acupuncture work?" And I go, "Well,"
long answer after that.
Neurotransmitters, dopamine, and they start getting this glazed over look, and you go, "I've gone too far already, haven't I?
I've lost them.
We've passed the point. Do you want to keep going?"
But I definitely do like that Western side of things, and it definitely helps me in the Go to Health clinic because I'm working with so many Western medical practitioners.
Yeah.
So to a degree, it means that they can understand me a little bit when they ask me if acupuncture can help a certain condition.
Yeah.
As well, but again, I'm still practicing all of those big Western words.
Yeah.
And understanding exactly how it works from that side.
Do you find it's well received with the other Western style practitioners that you're working with?
The ones I'm working with, they're for the most part, I think they're all really quite open.
Yeah.
A lot of them are getting acupuncture themselves, referring their clients over, because we really do the best as being like an integrative health clinic as well.
Yeah.
Yeah.
Well, that's good that they're getting acupuncture as well.
It definitely helps.
Yeah.
Yeah.
Yeah, that's good. Do you go and get physio, or do you go get anything from them?
I'm pretty partial to a regular massage, but often when I finish work I like to then leave work
Just go home.
and go home and kind of decompress from the day because they can be like mentally quite big days. So I might get a massage and pop on home. I have started seeing one of the exercise physiologists I work with. I didn't actually know much about what they did before I started seeing one. And now I'm seeing one. I'm addicted. It's awesome.
Really?
They're fantastic. I refer
Really?
lots of my clients to exercise physiology.
Okay.
Yeah.
So what's all of the hype?
Oh, yeah. That's a good question now. I am particularly enjoying my exercise physiology instructor. I'm not sure of the word. Practitioner. There we go. She's helping change my, I guess, relationship with exercise. So she actually goes a little bit into the kind of cognitive behavioral therapy side of things.
Okay.
Which is great because I was like, oh, I hate exercise, but I know it's good for me, but I don't want to do it, but I should. This real mental battle.
Yes.
And so I started seeing her and she helped address that side of things, helped with some pain I was having that was kind of preventing me from wanting to exercise, and has corrected all of those things. And now I'm loving it.
Yeah.
And it's good. And it, that really helps manage my stress levels, improves my quality of sleep, and lots of things that acupuncture also helps me with. But I'm just getting that kind of physical relief. When you're sitting in a clinic treating people, you're not moving as much as I would prefer to move during a day.
Yep.
So by seeing someone else, they encourage me to do that as well.
And as a practitioner yourself, the question was, do you have a regime to kind of balance out being the practitioner for someone else, and then do you have a practitioner for yourself?
I don't have one practitioner that I go and see. And I probably should be better with my own self-care. Like, I think lots of practitioners are a little bit guilty of telling everyone else how to look after themselves and not looking after themselves. I like to get some cupping pretty regularly.
Yeah.
I get, sore back from leaning over clients in bad positions while I'm trying to pop pins in. Cupping, massage. I do get a bit of acupuncture as well, but not as regularly as I know I should.
Yes, it's always the story that we're providing health and advice for everyone else, and we're often the last ones to take it and apply it to our own lives.
Yes. I guess I go through stages of going, I'm going to walk every morning for half an hour, and I'm going to meditate, and I'm going to drink lovely cups of herbal tea and all of those things to help balance out, the busyness and just regular life stresses. But I don't do that. at all. I roll out of bed, have a coffee and rush out the door.
Well, you certainly convey an air of wisdom on your videos. Like, you at least know what you're talking about, whether you apply it to your own life or not.
I go through phases, but yeah.
Well, you've got the exercise physiologist. You're obviously getting someone to be accountable for, which must help.
It definitely does help. I guess every little bit helps as well.
You were talking about in one video the effect of caffeine that it has on the body, if you remember.
Caffeine. I'm going to have a sip of my coffee now.
Yeah, I just had a
too,
sip of my coffee. Maybe not necessarily that particular line of information, but do you have anything you've been studying recently that's been of great interest that you can divulge to us, me and everyone listening?
One little bit of information. I've been recently looking at adult acne, hormonal acne.
Yep.
Being a sufferer myself, I'm quite fascinated in the mechanisms behind it and why we suffer from it and what we can do for it. And one really interesting bit of information I came across, and it's not even Chinese medicine related, was using spearmint tea as an anti-androgen. Apparently there is quite a few good studies done in women that were kind of developing a little bit of chin hair, like that hormonal hair.
Yep.
And they were using that to help treat women for their hormones that way.
Okay.
So now with my clients and they're coming in, for their acne treatments, is we add in a little bit of extra spearmint tea during their day.
Yeah, right.
Yeah. That's one of those random bit of information I came across that was quite exciting.
And is androgen, that's a hormone, what's that in charge of doing?
Oh, you know what? Good question. I'm not super great at the Western explanation of your hormones. The anti-androgen related to male hormones, testosterone,
Yes.
things like that.
Okay.
Yeah.
Well, that's good to know. If I know any patients that need some spearmint tea, I will prescribe. So for the future of your practice and for the future of acupuncture as well, what do you see happening in the next 10, 20 years?
Oh, there's quite a big difference to what I see happening and what I would like to happen.
All right, well, let's start with what we would like to happen.
Oh, what I would like to happen is I think, and along with most other acupuncturists, is I'd love to see acupuncture in the public hospital system and more accessible to everyone. I feel like at the moment it's not as accessible to everyone due to financial reasons as well. And we're not utilising it in our public healthcare system as we should be, especially to help with, our chronic health conditions.
Yes.
That tend to cost our health system quite a lot, and acupuncture could actually be quite effective at helping those things. Yeah. What will happen with it, I'm not sure. I think we have a lot of really wonderful researchers in the industry that are working really hard at getting the information about acupuncture out into the mainstream and presenting it, I guess, in a way that is understood by the Western medical profession. So I think they're doing wonderful work, and hopefully if they keep working as hard as they are, we will get where we want to be, which is, hopefully on Medicare and all of those things down the track.
Yeah, it's an exciting time to be an acupuncturist.
That's for sure.
When I started, probably you started a little bit earlier than I did. I had no idea about registration or anything really when I started in 2010, and I think that was the year that acupuncture became registered in Australia under APRA.
Yeah.
Is that right?
Oh, I wouldn't be sure of the year, but I remember it happened while I was studying.
Yeah.
Yeah, I think I'd been studying maybe even for a year or two, and we got registered.
Yeah. So it's been quite a journey for all of us, and no doubt for the people who already were practicing and have gone through this, seen this massive shift.
Yeah.
And from what they had known to what is now, some for the better, and some I imagine think it's not so much.
Yeah, I think the acupuncture community is probably definitely divided in that their opinions on what registration has done to our profession. Obviously, I've known no different. I've always had to be a registered acupuncturist, so it makes no difference to me. And I think there's definitely lots of positives that come from it as well.
Yeah.
Yeah.
Yeah. Yeah, I'm the same. I was ignorant to all of these political and government registration things, health registration. And so, yeah, I'm the same. I haven't known any different.
Yeah, so
And-
we just work with what we have.
Yeah.
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 I think it's been a good thing. While some people are not so happy about it, I do think overall it's been quite good for our profession and bringing us maybe a bit more into the mainstream
Yeah.
as well.
Yep.
Yeah.
Yeah. Yeah, it's certainly become obviously a lot more accessible, but with that accessibility comes a higher level of scrutiny for what we're doing to make sure that we're up to a certain standard.
Which I think is a good thing.
I think it is too.
We want to protect the public from maybe practitioners that haven't done the same level of study that we've had, or are not particularly up to the standard that we'd like. People that are sticking pins in people, I think we want to hold them to a high standard.
Yeah, sure.
Yeah.
Yeah, I think it's an acceptable thing to have a certain number of hours behind you before doing what we're doing.
Yeah, definitely.
Yeah.
Yeah. I again, that's something I get asked by clients a lot. They always want to know, how much study have I done? And a lot of them actually assume that I've done a course for maybe a year or something quite minimal in comparison to what we actually had to do to become acupuncturists.
Yeah. Yeah, I have had that as well. People asking you, say, 4 years. They go, sorry, what?
Yeah.
Really? That long?
They go, I thought that was like a month course or something.
Yeah.
And you go, try not to be offended. And like, no, I did a Bachelor of Health Science.
Yeah.
Yeah.
So what do you think what do you think are some practical ways that could be put in place that the public is more well informed about things like this?
I think potentially some more advertising that is understandable by your everyday people that don't know all of the TCM words that we like to use. They didn't grow up hearing they had a wind heat invasion when they have a cold. So when we use lots of words like that, lots of people will just shut down and not be receptive to the information that they're being given. So by kind of moving us into that Western medical model and then starting to use some of those words that are understandable to most people is going to make them a bit more receptive to coming to use acupuncture, I think.
Yeah, so you're saying it can be perhaps a little bit because of the foreign nature of the concepts that we use, it can be a little bit off-putting for the general public.
Oh, yeah, so many people, I can almost just see their brains shut off when I say chi. And you can see they don't want any more information about that. You start talking about channels and energy, and they're not willing or not open as much to that information. Some people love it. Clients can get really hooked on it, but other people not so much. So I think by combining that with the Western medical terminology, you're opening up using acupuncture to a larger audience of people.
Yeah.
Yeah.
Yeah. So when you bring up that term chi or the like, and you have that glazed over look from your patient, do you try to come up with a comparison, or do you try to explain it another way?
Yeah, I guess and again, it always comes down to the person that's sitting in front of me, what I think they might be willing to listen to. I like to bring the whole thing back to either talking about our kind of central nervous system, our sympathetic, parasympathetic nervous system, regulating the whole body. I also like to liken our bodies as like a really, really, really big city like London. And if there's a traffic jam on one side of the city, then messages are not necessarily getting through to the other side. And that's, I guess, how we explain why I'm sticking a pin in your foot for your neck pain.
Yeah, sure.
Yeah.
Yeah, okay.
Yeah.
So as in a distal...
Points as well. Yeah, because people, I guess, it will come in and they'll say, my neck hurts, or this particular area hurts.
Yeah.
And then I start touching their feet or their hands or somewhere completely unrelated. And you can just see them wanting to say, no, but remember I came in for this pain.
Yes.
So I always try to talk them through that as well, why we're doing points in different areas as well.
Yeah. Yeah, it can be, I guess, a little bit challenging if you're not putting points in the area that they have their pain. If they...
Yeah. I mean, I guess I always do try to do that. That was something I took away from college, is if someone comes in with neck pain or elbow pain, I'll pop a pin in the area, but that's not the only treatment that we do.
Yeah, of course.
Yeah.
Yeah. So getting back to nutrition, if we can, because this is something a bit more unique that don't think I've had anyone on here yet who's also studied in that area as well. Is that something that you will incorporate more? Are you going to do more study?
I think at some point I would like to, especially as I go kind of more down that women's health area, working more with, I guess, hormones and fertility. I think the nutritional side of things could be really good. But at the moment, I'm just trying to focus on learning the Kiiko style of acupuncture as well, trying to master one thing at a time.
Yes.
Learning too many different things is sometimes a little bit hard for my brain. So I pick one thing and focus on that for a while.
Yeah.
Yeah, but I will come back to the nutrition. And I'm still listening, to lots of different podcasts and trying to read what I can when it pops up.
Yeah.
Or if, a client comes in with a particular condition, I might go and have a look about what foods and supplements will help that person as well.
Sure.
Yeah, it's just learning as I go.
Yeah. And do you use herbs?
I use some herbs. I use mostly either the Chinamed kind of pre-done pills, prescription pills.
Yep.
And also I'd mostly do that also in conjunction with John Taylor as well. He's the wonderful herbalist at ginseng. So if I ever get stuck and I'm not sure about what herbal formula to use, I often just send him a quick message and say, I've got this person that has all of these things. What do you recommend?
Yeah.
And he gets back to me very quickly. Yeah. So I learn through John as well, with the patients in front of me.
Yeah, sure.
Yeah.
And is your approach to try to include herbs as much as you can, or do you do acupuncture first and see what the results are?
No, I definitely like to use herbs as soon as I can. Sometimes getting patients to the point where they want to take herbs is a bit trickier. People seem to be a bit more accepting of the acupuncture, but the herbs can take them a little bit of time to kind of go, maybe this will actually help me as well. There's probably been a little bit of negative press around Chinese herbal medicine.
Oh, yes.
Yeah, so people seem to be a little bit reluctant. But once we kind of can talk them around and how it can help them, again, especially regulating cycles, I think herbs are almost a must when you're coming to talking about women's cycles as well.
Yep.
Yeah, so I try to talk them into that as soon as we can. Yeah.
Sure. And with the Kiiko style, there are more workshops in the midst?
Yes, I will be, as soon as Monica, I can't pronounce her surname, as soon as Monica comes back, she's from the States, so she teaches the Kiiko course, and she will be coming back maybe in about 12 to 18 months, as soon as Peter from Geology can convince her to come back.
Yep.
She does a few extra courses on gynecological one, and I think a digestive one as well, and both of them obviously right up my alley of interest, so definitely we'll do more when she comes back.
Yeah, interesting.
Yeah.
So that's the Kiiko is Japanese style,
yes,
as you said.
Yeah.
So is that, I know you explained a bit before, I'm not really that much aware of Japanese style, other than that it is more gentle in its application.
Yep.
Is it, does it still use the same diagnosis system? Is it like, what are the differences and the similarities to TCM?
Okay, so less needle retention time, definitely. Because I know, with TCM we tend to pop the pins in and leave people for 20 to 30 minutes. So in the Kiiko style, it's often popping the pins in a much more superficial level, and then once getting the desired change either through the pulse or the abdomen, we can take the pins out again.
It's done.
Yeah. And they have their own kind of diagnostic patterns, I guess, as such. So they don't as much talk about your liver qi stagnation or your spleen qi deficiency as such. Yeah, they go mostly through the areas of the abdomen, and they call them also your pressure pain points as well. We talk about, positive or negative reflexes in them as well, and treat then there's a prescribed set of points for each positive reflex that you're feeling.
Okay.
That's hard to get. I'm still getting my head around it, so I'm probably not explaining it the best.
No, it sounds interesting. So there's a positive and negative reflex to the practitioner's touch or pressure. Is that
yes? Yeah. Okay. So for example, they use fire points on the yin channels of the body, and the idea is that you press or palpate that point with about 3 kilograms of pressure, which I'm still learning what 3 kilograms of pressure feels like. And some patients will start scrunching up their face and go, ow, that really hurts. Other people go, I don't feel anything.
Yep.
So when it's a bit tender or sore or anything like that, that's a positive reflex. Positive response in that area.
Yes.
And then we use the metal and water points on that same channel to treat that pressure pain.
Okay.
And the idea is that once you pop in those 2 points, you go back, you re-palpate that area, that fire point on the yin channel. And the idea is that the pressure pain, if the pins are put in properly, should have dissipated.
Okay.
And that's that kind of instant feedback that you're getting from the body, that you've selected the right points and that you've needled them correctly as well.
Yeah. Okay.
Yeah.
So they use quite a heavy influence of the 5 elements, or is it just the points that are designated to fire or water? Or
you know what? I don't know.
Okay.
I actually don't know the answer to that one.
So it's not so much organ based then?
No, it doesn't seem to be. I've just done the foundations course, so I'm sure that there is much more information than we got exposed to over those 4 days.
Yep.
Because it was kind of like a crash course in this very obviously complex style of acupuncture, like all different styles of acupuncture can be, as well. So I'm just starting with the basics at the moment. Yeah. And then we'll kind of delve into it further once I feel like I've mastered a few of those.
Yeah, okay.
Yeah.
Yep. Michael Corradino, he's a acupuncturist in I don't know which state, but in the States somewhere. He pioneered neuropuncture, which is the concept of stimulating specifically the nerves along with the channels, and there are a range of different points, neuropuncture points, that are near the original points, but they're focused more on stimulating the nerve.
Oh, okay.
So, for example, gallbladder 34, there's a neuropuncture called acupuncture point of gallbladder 34. Sorry, neuropuncture point of gallbladder 34 that is behind the head of the fibula instead of in front.
Oh, interesting.
And then that stimulates the superficial perineal nerve.
Okay.
As opposed to specifically the acupuncture point itself.
Yeah.
Anyway, that is all irrelevant. What is relevant is that Michael Corradino says to learn how to figure out what 3 kilograms of pressure or 3 pounds of pressure, whatever your system of measurement is whenever you're at the grocery store.
Yes, I've been doing this.
Is that how you're doing it?
Yes.
Yeah, right.
That is what Monica said as well.
Yeah.
And so I look a little bit like a weirdo when I'm in the grocery section and I've got my thumb, on the scale, trying to go, oh, yep, and then close my eyes and do it again to see if I'm getting it right.
Okay.
Yeah. That's good. I'm glad there's more than one person suggesting that way of doing it.
I thought that was a great idea.
Yeah.
I mean, after a while, it's like anything. It's like learning the pulse. It's like learning for the feeling of chi when you're acupuncturing. You would learn what 3 kilograms of pressure is.
Yeah.
Yeah, and that's a good way to, because you're right, it's very subjective for the patient and objective for yourself when you're pressing on someone and they say that hurts and you go, is that tender or is that painful? And you could have someone who's 3 times the size of you and they don't feel it, whereas
exactly
the next person, they're in agony, and you can't figure out if that's because they're in pain or if that's just their sensitivity.
Yeah, that's a good point.
So I suppose if you're applying the same amount of pressure each time, that would at least help to eliminate some of those variables.
Yeah, exactly.
Yeah.
So I'm still learning the 3 kilograms of pressure.
Mm-hmm.
Yeah.
Mm-hmm. I like it. So how do you feel about that being, if you're using this Japanese style of treatment, which is clearly vastly different to a
Yes.
Chinese style of treatment?
Yes.
How do you have you considered the fact that they both work?
Yes.
They're both effective.
Yes.
Right. There are all these different styles of acupuncture which are effective.
Yes.
And so how do you kind of rationalize that when they're doing vastly different things but you're getting similar results?
It's actually something I've been struggling with, which is, it's interesting that you bring that up. So, I've worked with people in the past that are fanatically Japanese acupuncture only. It's the only way, and everything else is not as good. And then when you're learning, TCM in college, you go, oh, why would you learn anything else? This works. This is perfect. So, while I was doing the course too, it was a bit confronting because lots of the people are quite, this is the way to treat.
Yes.
But I, from clinical experience is, even though I started treating one way and I moved to treating another way, and then sometimes go back to treating the way I was treating before I did the course, is it all works as well. So I just like to treat, again, the way the person in front of me I think would like to be treated.
Yeah.
I get some people come in and I can tell that they have a sore spot, and so they want all the pins in that area and they want strong needling. So I might go a little bit back to TCM based acupuncture.
Sure.
And then other people, they already come in and they say, I'm a little bit scared of needles. Does it hurt? And that's when I'm more likely to start with that Kiiko style of acupuncture.
Yeah, that's a good point to have. That's a good point to have all of these different styles to fit the different people that come in.
Yeah, because they do. They all work. They all work in different and the same ways as well. And I really don't believe that one style is better than the other. I think learning a few different styles is great because you can apply that to lots of different people as well.
Yeah.
Yeah.
Yeah. I suppose it's about, that's a concept of becoming the Bruce Lee of acupuncture, having no style, absorbing all styles and having none.
Yeah, exactly. That's what I aim to be.
I like that. It's something to aspire to.
Yeah.
Is your Instagram account primarily set up for your patients or for practitioners to learn to or learn from, or both?
I'm going to say both. Mm-hmm. It originally was designed for patients.
Yes.
And also for my own little outlet of wanting to talk about things health without my friends making fun of me for always talking about health stuff. And it is starting to become a little bit... I'm attracting a few different practitioners just because we all like to hear what other practitioners have to say. And I guess Instagram's quite a good platform for hearing other people's opinions on things as well.
Yeah, absolutely. Yeah, I think the more we do things like that, I mean, I learned something from you about the analogy of exercise for acupuncture treatments.
That's a good one.
So I thought that was very, very good. That was a gem there. So I think we can only improve by having all of these different outlets that we can all see from each other and keep learning from each other.
Yeah, I definitely think so. I mean, I follow, every acupuncturist I meet, if they've got an Instagram, I'm following that. Because I like to see what they're doing. I like to see how they're treating. I love to see how they're explaining things. Because we've all got our own ways of explaining things, and I think we can definitely all learn from each other in that regard as well.
Yeah, absolutely.
Yeah.
So what's on the cards for the future for you? As far as treating goes, do you have plans to open your own clinic? I suppose you don't really want to divulge that when you're working for two. Far down the track,
Yeah, no, it is far down the track because I see the energy that goes into running clinics and it's a lot. And so at the moment, I'm really happy letting other people run the clinics, and just that's giving me a chance to learn more and be a better acupuncturist without being preoccupied with the running of a business component.
Yeah.
But I think down the track, I mean, maybe a decade, maybe 2 decades down the track, I would really like to run my own practice.
Yeah.
I would like a women's health focused clinic, multiple practitioners. Not, I think somewhere between, probably 5 practitioners would be the goal. I'd love to have a lovely little healing space where people can come in and be heard and also be informed and given all the knowledge they need to make, good decisions about their health in that regard. Yeah, because I don't think we're always given all of the information we need. Yeah, so that's what I would like one day.
Yeah.
One day.
I think that's a nice goal to have a holistic place that someone could come to and just your place is the final stop. That's all they need to do.
That would
as
be
much as you can.
Yeah, that would be the goal, I guess, at some point.
Yeah.
Yeah.
Whereabouts can people find you online?
Oh, I have a website, which is www.acupunctureaus.com. I have Instagram. Jacinta Eales _acupuncture. Recently changed from acupuncture and nutrition.
Yes.
Easier to find with your name, I think. Yeah. So I'm trying to be all over online so people can get in touch with me if they need to.
Yeah, cool. And you have a blog as well?
Oh, yes, attached to my website.
Yes.
Yes, I probably should write more blog posts, but I haven't really got there lately with all the extra study I've been doing.
Yeah.
Try to keep that as up-to-date as I can.
What's the usual topic or subjects that you talk about?
I used to jump all over the place with whatever was interesting me on that day that I was writing a blog post, but I am trying to swing again to more towards women's health, skin focused, period health, fertility. I'm trying to go more that way at the moment.
Yeah, awesome.
Yeah.
Yeah. Once again, always good to have those resources for patients or other practitioners to go out and find things to improve their own practice as well.
Yeah. It's good to read other people's writing styles as well.
Yeah. Well, it's been a ball. Thank you so much for coming in.
Thanks, Chris. This wasn't as scary as I thought it would be.
Not at all. See, I told you you'd forget that all of the lights and the cameras were here.
Oh, now you've just brought my attention back to it all.
Thank you so much for coming on, Jacinta.
Thank you very much, Chris.